So I'm with David Ashford, the Minister for Health and Social Care. This is Monday, we're recording this. Should we talk about Friday? I think that's probably what
you wish to, Paul,
things on my mind, things on a lot of people's mind. I mean, what were you doing? Why would you want to bring out that letter the way you did? Seriously, I mean, really seriously, because it kind of really changed the balance of that whole thing.
Well, the person wrote to me on Thursday. I received the letter in the post.
So you got it on Thursday. Because I want a timeline on this.
Yeah, so I spoke to them Thursday night because there was a contact number on the letter. They had, despite what's been said, it wasn't an anonymous letter.
No,
they
you
had
said
signed the letter. I did say that.
But
in
you
the press
didn't want.
briefing,
They didn't want their name.
They didn't want their name mentioned,
right,
because they didn't want to be in the media spotlight. They just wanted their views airing. I spoke to them, and they said that other views have been aired, and if the issue was raised again, they would like their view aired. And obviously it would have seemed very odd when I was only talking to you early in the week saying everyone's views are welcome, to then turn around and say, well, no, I'm not willing to air your views. Okay.
Well, for people who didn't see it, just give us a rough guide to what that letter said then.
Well, basically, the writer of the letter, I think, was a bit disheartened by the media coverage that had been over the previous week and a bit. They felt, and this is their personal view, I've got to say, it's the personal view of the letter writer, they felt that the media coverage had portrayed that the entire testing regime was about one person rather than the team as a whole, that they felt also deserved recognition.
Now, by the very nature of it, I have to come off the fence slightly, as I did on the thing.
Yeah.
Surely our job is to report.
No, and I fully agree with that. I said to you at the press conference, if you remember, that personally, the role of the media is there to interrogate and report, and that's what you've been doing.
So if you got a letter from somebody else this week, and maybe you have, that's got a 180-degree opposite view, would you then pick that one out to be read? And I mean, where are we going with this? As you say, it's a personal view from one person. I mean, you know.
But it was someone working within that area who
You've seen
felt,
the feedback though, haven't you? I mean,
a
lot of people say they don't agree with it. I mean, for instance. Yeah. So we're in the sort of middle area. No one knows what to believe because no one can necessarily prove it, can they, one way or the other?
But like I say, I promised that person that they were very upset when I spoke to them. And I promised I would air their views if the topic came up. The topic might not have come up on Friday, so it may not have actually been aired at all.
Do you regret reading it out?
No, I don't, because it is that person's view. And I made clear when I read it out that it was important their view was shared.
Yeah, but it kind of made us, and I'm again talking about the press side, almost making us the bad boys. It felt like that. I mean, that's why I had to come in and say something almost, because you can say a lot in that press conference and people believe everything you say, and rightly so. You're the Minister of Health, maybe. I mean, other people may not. That's what our job is, to cross-examine or to ask questions of you. But do you see how it could affect the way the press was seen by that sort of comment, even?
Well, I think it's important that it is expressed out there that sometimes people can react badly to the way certain things are reported, and I think it's important we acknowledge that. That's nothing new. But I mean, I want to put on record again, and I don't know how many more times I can say it, but I do want to put on record again my thanks to Dr. Glover, because as I said in the interview we did last week, she's a highly intelligent, highly knowledgeable person. She's exceptionally good in her job, and she has been instrumental in setting up our testing team, and so has the whole lot of pathology and microbiology, who've all worked hard and ensured that we've got a testing regime that operates 24/7. Okay. So both Dr. Glover and the entire team are owed a debt of gratitude.
We're in a very weird situation because she didn't want any press about it, but she's gone on in the first place to create it. I don't understand how we cannot deal with it when that happens. It wasn't handled well then. Let's try that one. I mean, you're saying one thing, she's clearly not agreeing with you.
I'm not quite sure what you mean by not agreeing, because I'm not quite sure where the points of differences are. Okay,
so you think it wasn't at all like that? Because that's maybe how it read to some people.
Yeah, but that's the bit that I must be perfectly honest, I'm personally confused about, because I'm not quite sure where we have points of difference.
Right.
Because we've stuck rigidly to PCR testing, which is the gold standard test. We had to remove 7-day in test, but we did have that initially, but we had to remove it because of the risk. But we are looking at what other sort of surveillance testing we can do, maybe the options of day 10, etc. We haven't gone down the route of just testing at the borders and then releasing people, because that would actually mean that you pick up very few infectious cases and you'd be releasing people into the community potentially still infectious.
Although Guernsey has this, 2 more this morning, I believe they've got now, but they found them at the border, didn't they? They did get them tested as they came in.
They did, but they still have to go into isolation.
Indeed, but they caught them there. That's what I'm trying to say. The test caught those 2 there.
But it doesn't really achieve anything if people are having to isolate anyway. So I'm not.
We
quite
go around
sure
circles and say no.
Yeah.
I know.
So I mean, all I can say, like I say, I mean, there's nothing more I can say other than I am exceptionally grateful to Dr. Glover for all of the work that she's done. I think the work she's done within DHSC has been magnificent. And as I have stated on numerous occasions, you know, I think that the whole team has done exceptionally well to ensure that we have the response we have. We have got a testing centre here on Ireland that is second to none as a result of that work, and that other jurisdictions would actually be rightly proud of if they had it.
And as I know it, as far as I'm aware anyway, Dr. Glover is still not doing any interviews, so we only hear your side anyway. She kind of seems to respond by the odd Twitter feed or whatever else, but I mean, we'd love to hear what she has to say. I think that would help balance everything up, wouldn't it?
Well, like I say, I can't speak for Dr. Glover, and I have no intention of doing it.
I'm just trying to explain to the audience why we come to you all the time and we don't hear the balance view.
But like I say, from my point of view, I think the work Dr. Glover's done is absolutely excellent, as is the work of the entire team across DHSC.